Good morning, Miss Marshall. My name is Shakana Mack, and I will be your nurse for today. Thank you for coming in to your appointment today. I know it might have been difficult to get here, but I'm happy that you made it. Have you had any symptoms of feeling weak or short of breath, or your blood pressure been running high? You've been excited or anything? Okay, so your blood pressure has been running high. Are you taking your medicine as prescribed from the last time you were here? Okay, so what were you previously prescribed? Lisinopril? Okay. All right, so do you have any history of falls, of any type of other health condition I need to be aware of for today? Okay. Do you have any questions for me to relate to the doctor? Okay. All right. Thank you. All right, so I'm gonna start by checking your blood pressure, okay? All right, your blood pressure today is 158/95. Heart rate is 73. Okay, have you been stressing about anything today? Does anything worry you or make you feel uncomfortable? Okay. All right. Well, I'm gonna go get the doctor and I'm gonna let him come do his observation of you and I'll be right back. Your doctor had just given you your diagnosis of lupus as well as hypertension. I'm gonna give you some information on your lupus diagnosis. All right, so lupus is a disease that occurs when your body's immune system attacks your own tissues and organs, which is also known as autoimmune disease. Inflammation caused by lupus can affect many different body systems, including your joints, skin, kidneys, blood cells, brain, heart, and lungs as well. Lupus can be difficult to diagnose, but its signs and symptoms are very thorough. Some people are born with a tendency towards developing lupus, which can also be triggered by infections. Okay, no lupus case is going to be exactly the same. There are different signs and symptoms that may come with the sudden development of lupus. They can be mild and severe. They may also be temporary or permanent. These signs or symptoms of lupus for you to watch out for is fatigue, fever, joint pain, stiffness, and swelling. You may develop a butterfly-shaped rash on the face that covers the cheeks and the bridge of the nose. You may also have a skin lesion that may appear and worsen with sun exposure. Fingers and toes might turn white or blue when exposed to cold or during stressful situations. You may also develop shortness of breath, chest pain, dry eyes, and headaches. The causes of this disease occurs when your immune system attacks healthy tissues within your body. It is likely lupus that results from a combination of genetics and your environment which you live in. Sunlight exposure may bring the lupus skin lesions on. Infections can initiate lupus and can cause a relapse in some people. Medications. The doctor has put you on Plaquenil, which I'll need you to take twice a day. This medication may help to reduce the effects of lupus. You may also be added on with anti-seizure medications. You also have a diagnosis of lupus due to your blood pressure condition, possibly could be a cause of this. The signs that you need to watch out for if you're having an attack, just make sure you know when to call your doctor. That's the best way. If you develop a fever of more than 101, consult your doctor. If your rash is getting worse and has not subsided, you need to come in and be seen immediately. By you being an African American female, you, Hispanic, and Asian Americans are at more risk of developing lupus. You also have said to have chronic kidney disease. Your kidneys from lupus can be a serious kidney damage or kidney failure can be a cause that can cause somebody to die. If your brain is affected by lupus, you may experience headaches, dizziness, behavior changes in vision, You may experience memory problems. Your lungs, with having lupus, can increase your chances of developing an inflammation in the chest lining, which may cause your breathing to be painful and difficult. Bleeding into the lungs and pneumonia are also possible. Having lupus might increase your risk of developing an infection because the disease and its treatments can weaken the immune system. If you have lupus, it may increase your chance of developing cancer. However, the risk is very small. You may also develop bone tissue death. This is when the blood supply to the bone declines, often leading to tiny breaks in the bone, eventually to the bone's collapse. All right, for your second diagnosis, it is hypertension. I know when you came in, you had the white coat syndrome. Sometimes that might increase your blood pressure, so I'm gonna check it again before you leave for today. But I have information for you for your blood pressure. So today your blood pressure when you came in was 158/95. That is high, and with you being on blood pressure medication, you may need to have adjustments done. All right, so high blood pressure is a common condition that affects the body's arteries, also called hypertension. If you have high blood pressure, that force of the blood pushing against the artery wall is consistently too high. That makes your heart work harder to pump blood throughout your body. Blood pressure is measured in millimeters. Hypertension blood pressure readings of 130 or 80/80 or higher is known to have hypertension. The normal blood pressure goal is 120/80. The top number ranges for a elevated blood pressure is 120 to 129, and the bottom being below but not above 80. There are two stages of hypertension. You have stage 1, which the top number is from 130 to 139, and the bottom number being between 80 and 89. A blood pressure higher than 180/20 is considered a hypertensive emergency or crisis. If your blood pressure has reached this level, seek emergency medical help immediately. If your blood pressure goes untreated, you are at the risk of developing a heart attack, stroke, and other serious health problems. It is important to have your blood pressure checked at least twice every 2 years, starting at age 18. Some people need more frequent checks. Healthy lifestyle habits such as not smoking, exercising, and eating well can prevent and treat high blood pressure. Some people may also need blood pressure medicine to help treat high blood pressure. Symptoms of high blood pressure includes headaches and shortness of breath, for example. Blood pressure screening is an important part of general health. Ask your provider for blood pressure readings at least every 2 years, starting at age 18. If you're age 40 and older and you're between 18 and 39 with high risk of blood pressure, ask for your blood pressure to be checked every year. Children aged 3 or older may also have blood pressure measured for yearly checkups. Today, your doctor has increased your dose of metoprolol and wants you to take this medication twice a day. Blood pressure is determined by two things: the amount of blood the heart pumps and how hard it is for the blood to move throughout the arteries. Secondary hypertension is a type of blood pressure caused by an underlying condition. It tends to appear suddenly and cause high blood pressure that does not primary hypertension. This condition and medicines that can lead to this is adrenal gland tumors, cough and cold medicines, illegal drugs such as cocaine, amphetamines, kidney disease, obstructive apnea, and thyroid problems. High blood pressure has many risk factors, including age. Until you're about 64, which you're over that age, high blood pressure is more common in men. Women are more likely to develop high blood pressure after the age of 65. Race and high blood pressure is particularly common among Black people. It develops earlier in age in Black people than it does in white. Foods that you eat, such as foods that have high sodium, can cause your blood pressure to increase because sodium intenses the amount of fluid that you have within your body. Family history. Do you have any family history of hypertension in your family? Okay, yes, your mom. Okay, if your mom had high blood pressure, you need to make sure you get checked as well. You don't have any issues with obesity, but obesity can play a factor in having high blood pressure. You might need to start exercising. Exercising helps raise the risk of reducing your risk for blood pressure problems. You don't smoke any tobacco anymore, so that's one step towards reducing your risk of hypertension. Low potassium levels. We have been watching your potassium level as well. Potassium also has a factor to play with your heart. The proper balance of potassium is important for good heart health. Low potassium levels may be due to lack of potassium in diet and certain health conditions, including dehydration. If you consume too much alcohol, it has been linked with increased blood pressure, particularly in men and women. Stress level can cause an increase in blood pressure. So it's best to minimize your stress and basically, keep it at a certain level. Sometimes things can stress you out, but it's best to keep it on the low. All right. Kidney disease, diabetes, and sleep apnea are, like I said, conditions that can lead to heart disease. Some complications of heart hypertension is a heart attack or stroke, which is hardening and thickening of the arteries due to high blood pressure and other factors that can lead to heart attack, stroke, and other complications. An aneurysm is a blood vessel that weakens and bulge, forming an aneurysm. If an aneurysm ruptures, that can be life-threatening. Heart failure. When you have blood pressure problems, the heart has to work harder to pump blood. The strain causes the walls of the heart's pumping chamber to thicken. This condition is called left ventricular hypertrophy. Eventually, the heart cannot pump enough blood through the body. High blood pressure can cause blood vessels in the kidneys to become narrow and weak. So with this, you need to pay attention to this as well because you do have chronic kidney disease. Blood pressure can thicken the blood vessels within your eyes, which can cause vision loss. Changes in memory and understanding is due to uncontrolled high blood pressure affect the ability to think, remember, and learn. Dementia is caused by the blocked artery that may limit the blood flow to the brain. This can cause a type of dementia known as vascular dementia. A stroke that interrupts blood flow to the brain can also cause vascular dementia. All right, so I have a few handouts for you to take. And I have a brochure. So this right here is about your lupus and kidney disease. It'll give you all the basics you need to know, what to look for as far as your symptoms, the tests that may need to be done, and how things are treated. Also, I know you don't want to become pregnant, but it has tips and tricks on that too. All right, and I have a brochure. This brochure about hypertension, it gives you a lot of information to know what hypertension is, what to look for, how to treat it, when to call your doctor. I'm going to let you have this information to take home with you. Now, do you understand everything that I was explaining to you today as far as your diagnosis and what to do in order to treat these symptoms? Do you have any questions for me? Okay. Or are you able to teach back what you learned and how to basically care for yourself at home? Also, make sure when you're checking your blood pressure, make sure that your blood pressure cuff is at an 80-40. You want it to be able to fit around your arm, but only have 40% of the cuff. With this, Make sure you have the artery position facing your arms, brachial artery. Record your blood pressures each time that you take them so that we have a record of whenever you come back to your next appointment. All right, is that help you with all the information for today? All right, thank you.